must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show. Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm one of your hosts, and of course, I am Brandon Poen. And for my other two co-hosts, F. Scott Field and Stephanie Ryrock, they are both unfortunately able to make it to today's episode. However, today we have two very special guests for today, talking about the Education Leadership Institute Fellowship Program. As today we welcome Dr. Jody Frost, who was the founding program director of the Education Leadership Institute Fellowship Program, or we're going to call it throughout this podcast episode ELI for short, and Dr. Anne Reicherter, who is the current director of the Education Leadership Institute Fellowship Program, and she is also the director of academic and clinical affairs at the American Physical Therapy Association. Now, ladies, thank you both for your service and dedication to the profession, as I know that you have both been very heavily involved within the PT profession and with APTA. And do you think you can kind of tell our audience briefly a little bit about who you are and kind of what led you to where you're at today for our audience who perhaps hasn't heard of you?
So, hi, thank you, Brandon, and your group for inviting us. And so this is Anne Reicherter, and firstly and foremost, I am a PT. I'm still a practicing clinician. I am a board-certified clinical specialist in orthopedics, and I've practiced for a long time. I'm originally from near Pittsburgh, Pennsylvania, and I went to the University of Pittsburgh, and I worked in that area for quite a few years, about 15 years, and then I relocated to Washington, D.C. to become a full-time faculty at Howard University, which is in the district. And then I also got my PhD there in educational psychology. And then I also worked at the University of Maryland in Baltimore in the physical therapy program. And then I was director of clinical education there. So, and then I wanted to explore other avenues, and I actually went back to the clinic for a while. So I've been recently in the clinic with all of its vast changes from when I did it a bit more earlier in my career. And then I came to APTA and worked in the Department of Practice. And I went there 3 years ago, and I worked primarily on PT Now, which is the evidence-based practice resource. And then about 6 months ago, I moved back into education at the APTA, and I'm in my current role of Director of Academic and Clinical Affairs.
Thank you, and thank you so much for the invitation and your team to let us be a part of this podcast. So I'm Jody Frost, and I actually am currently semi-retired. I'm a consultant currently, and I began my profession as a graduate of Ithaca College, and I'm not going to say when. And I began my career in pediatric physical therapy, actually in Children's Seashore House in Atlantic City, which no longer exists, is now at Children's Hospital Philadelphia. I was a center coordinator for clinical education and the department head at that point for physical therapy, and had an opportunity to move into academia at Temple University and became their director of clinical education and their assistant chair. We also had a faculty practice at the time and continued to practice in pediatrics and medicine, as well as at Children's Hospital. And then a rare opportunity came for a new position as Associate Director of Clinical Education at the American Physical Therapy Association. And I initially thought I was going to be there for 5 years, and 25 years later, I actually was still at APTA in a number of different positions, and eventually became Director of Academic Affairs, and brought together academic and clinical education into one department, and then had an opportunity to launch a program called ELI, and it was having to do with the future of our profession and education. And in December of 2015, I actually retired from APTA, moved on to a consultant role, and I'm very involved in interprofessional practice, education, and research, and currently serve as the president-elect of the National Academies of Practice right now.
Well, awesome. And it's so great to have you both on, and especially talking about, this unique program and such, because I know in general, you both have been pretty heavily involved, with Jody being the founding program director and Anne being the current director. So, for perhaps some of our listeners who have not really heard of this program specifically in general, what exactly is the ELI program?
So, Brandon, as you mentioned, it is the Education Leadership Institute Fellowship, or ELI. And it is primarily a program to develop skills, behaviors, and leadership in aspiring or current program directors of physical therapist and physical therapist assistant educational programs. So it's a 13-month fellowship program, and it uses blended learning. So it has a high degree of distance education. However, it does use face-to-face meetings 3 times a year for several days.
Cool. And just for kind of some other people, like something that, of course, I always think about when I'm considering something for continued development that, of course, has to be in the back of my mind for consideration is cost. And when looking up on the website for the ELI program, it says that the total cost for the program is about $12,000, with a tuition rate being about $6,500. So just to give our listeners some context here, do you think you could kind of tell us specifically what is included within the cost for the program?
That would include access to all of the course materials, the cost for the speakers, and things like that. That's for the tuition, etc. However, there are books, as every student knows, and also ability to travel and financial support is needed to travel to the face-to-face meetings.
Gotcha. So kind of gathering that it's about a 13-month program, and there's 3 meetings, of course, in which people kind of get together. Just because for our listeners who are perhaps a little bit curious, like I know you kind of mentioned the overall brief layout of what the program is, but kind of how is it generally structured within those 13 months to kind of go over kind of specifically what those people that are going through the program are going through?
Right. So I kind of look at it as the rule of 3s, it seems. So it's well designed. And so I can compliment Jody and the initial groups that developed it. So the 13 months is basically split into thirds, and there are 9 modules total. And each module, group of modules, 3 modules, are of a similar topic and grouping. So the first 3 modules basically tries to get the fellows on a grounding of what is leadership theory, what is leadership at their institution, looking at a lot of self-reflective pieces. And then after that first module of 3s, they have an on-site meeting, which is held at the Educational Leadership Conference, which is held in the fall. And it's held just prior. It's not part officially of the meeting, but it's held prior. And we just see a large benefit to that is that then that's the first time that the fellows get to meet one another in person. They start to network, and then prior to the ELC, it's kind of a nice initiation to have them network then within the broader educational leadership of the association and academia. Then the second 3 actually have a lot more to do with their legal issues, human resource issues, student affairs. So kind of the nuts and bolts of what might be in their jobs. And then the same thing occurs. There's an early spring on site where they get together, and in addition to the speakers from the groups are there via virtual. And so it's a nice interaction in conjunction with their mentors. So they work with their mentors both distance and on site at these meetings. And then the next third has financial and other types of leadership, kind of like a closing session as well. And then they have their last on-site, where again, they basically will work on what they've learned. They work on a development project as well, a leadership project. And so they also have a graduation then at that last event at the end of the year.
Very cool. And, I know kind of just going back and you kind of talking about kind of what it involves now. So Jody, with you being kind of the founding director of the Eli program, do you think you could tell us kind of about the why and kind of how this program was initially developed to kind of give some context?
Sure, happy to do that. So in 2008, there was a group that came together, an oversight group, and these are visionary individuals, and they range from a provost of a university to a dean to faculty who were PT and a PTA program director as well. And they conducted a needs assessment, and the needs assessment was to determine what is really going on in higher education leadership. And they discovered a significant shortage that was being anticipated in 3 to 5 years in both PT and PTA program directors, the likes of which was around about 135 of those directors. And the question arose, how are we going to fill those vacancies with individuals who have the knowledge, the skill, the vision, and the strategic thinking to be able to handle higher ed leadership, which has changed dramatically over the last 20 years. You really, budget implications, position, power, the authority, those types of things that go in that position are at risk if you don't have competent leaders. So the next thing we did is there were actually two of us, my colleague Janet Besner at the time, who was vice president, and myself. We actually went other higher ed leadership programs to explore and create a matrix of what they did. And they included like medicine, and we actually had a representative from medicine who was currently a president of a university who helped develop AAMCs. We went to dentistry, pharmacy, speech language pathology. We looked at Harvard Business School and HERS leadership program, and we were comparing them across like categories. So length of program, what they were called, what the graduates were called, what the cost was, how they were structured. And based on that and the needs assessment, a third assessment went out to current program directors asking if you were to build a leadership program, what content should be in it? And we asked them to rank order and high priority. And interesting, everything was a high priority. There was highest priority, medium high, and low high, but nobody listed anything low. So with that, they put together what was the outline that is now what the current Eli program looks like. So we went with a hybrid model. The other programs we looked at did not have a hybrid. They were all face-to-face. And based on a survey, we discovered that our faculty could do some face-to-face coupled against a conference like ELC, but they had to do most online because they were working. And that they wanted the leadership embedded in what they were doing in their institutions. And one of the other critical elements is that the institution that they were working at is the one who pays for the tuition. So the application, the nomination has to be in partnership with their supervisor who says, yes, this individual on a recommendation is ready for this, has the time to do this, as well as residency and fellowship program directors, directors of clinical education. Unfortunately, with this program, early on, we had to make the decision it was not for clinical leadership. And we had in the past people applying and asking, I'm director of a PT department in clinical practice, and I come to your program. And this program was designed specifically for higher education leadership, not that a comparable one couldn't be developed for practitioners. The other thing that happened is after we had all this data, as a member of APTA and a staff member, you have to go to the board of directors and gain approval. So the board of directors saw a 3-year budget laid out, saw the program, a strategic vision, goals, objectives, priorities, applications, admissions, everything was built in the program for them to determine whether they would approve it or not, in collaboration with partners that include the education section and ACAP. And that still is true today. It is a partnership of 3, and so they're represented on the oversight board. There is always somebody from the PTA area, they're from ACAP, from education, and from residencies and fellowships. And then the last piece of this that was probably the most interesting nut to crack was moving it from a program to an accredited fellowship. At the time, the American Board of Physical Therapy Residencies and Fellowship Education did not have any non-clinical programs. They were all based in clinical practice. This was the first one where we provided a prospectus to the board, and it was to approve a non-clinical fellowship for the opportunity to go through the accreditation process and become an accredited fellowship. Unfortunately, the timing was right. The board was very interested in learning more about this. It was the first program to go through, and it went through with flying colors and has also gone through a reaccreditation process under both Libby Ross, who was the former director, who currently is an accredited fellowship by the American Board of Physical Therapy Residency and Fellowship Education. The reason that's important is that puts a high standard and seal approval on this program, that it had to meet a quality threshold that's comparable for other fellowships across the profession and other professions as well. So I think that's also important, that Eli is not a continuing education program. It has met the hallmarks of quality standards for a accredited fellowship.
Yeah, no, and I think that's really interesting to kind of hear the process with how it kind of was developed, with gathering a lot of feedback from current directors, really taking a look at other interdisciplinary programs to really gather. And I think that's really good when developing that. And, you know, something, of course, you mentioned a couple things in your previous answer here, but just for a couple others. And if Anne has any other comments on this, I'd love to hear them. But you know, of course, as you said, this program is intended for people that are either looking to become either a PT or PTA program director. So it's meant for higher education leadership. So why would you recommend going through the Eli program over other options, such as, or even just going into academia and receiving mentorship that way for more on the job?
So thank you, Brandon. And I agree with you completely. This is a really good question. And it kind of gets at why many of our graduates are really, really successful. And we'll talk about that more. They're actually on our website, there are some testimonials on why fellows did become part of the program. We just really feel that there's the extensive resources that are available within Eli. And having been at several institutions myself, is that many institutions don't always have that type of structure. In fact, many of them don't that have the leadership development. And even when they do, it's usually very specific to that institution versus kind of that broader view of physical therapy education and also the academic world in general. So that's a benefit that our faculty and that the Eli program bring. It doesn't replace, though, the necessary input and support at your institution, which is why Eli requires an institutional mentor. So in addition to the physical therapist, administrative mentors that we rely on through Eli. And then the second thing is that we also have this blended delivery system, which again, back to support, is really important. And I would just say the depth of the resources that are available. So if Jody wanted to add anything to that.
So a couple things. Many people do start with mentoring within their institution. And when they determine that they would like to be in higher ed leadership, one of the things about Eli is it's not the assumption that they may stay in their own institution. The opportunity may not present itself to be able to stay there, and they can go to other opportunities in other institutions, which many of the programs now seek Eli graduates for those positions. We've also had within the program associate deans and deans, so people actually at a higher level who are PTs who never got the opportunity to have this. The mentors that are in this program are actually selected through criteria. And they are senior leaders and innovators within the profession who may be now deans in a program, may have been a former PT or PTA program director. And so the opportunity to have that kind of mentorship that's in a safety net. And by that, I mean, in their own institution, there may be topics they wish to talk about that are a bit sensitive. And within their institution, people may know who those individuals are without naming them. At an Eli, when they're in a small mentorship group with peers, they can talk about those with a safety net with no repercussions to really generate some creative ways using the theory and the literature and what they've learned and integrating it specifically in their situations contextually to figure out how to manage that. The other thing about Eli is it's not designed to be competitive. It is a collaborative experience. And in some cases, people may be from the exact same city attending. They may be in different groups, but they form lifelong connections and strong ties. Our very first cohort, there were 13 of them, are still connected. They still have reunions. They still always are in contact with each other. So they are very well connected, confident, trusted mentors. Some program directors have come into new positions and leveraged Eli as part of their initial contract for signing on. So they want to be a new program director, but they sign on with the understanding that the institution will support them in a higher ed leadership. You know, in some other professions like dentistry, like medicine, many of their program directors have first come to the institute. That's how they come up through leadership. So it's actually become part of their culture and how you manage that. The other thing is the leadership opportunities in here, the ability to network with other people. Sometimes some of the people might be a DCE, there's a program director. They network and actually the person finds a job with somebody within Eli and they form partnerships and they have like language. They have same context. And our graduates, the best ambassadors, bar none, for the program have been the graduates. They wear an Eli pin, they connect with people, they have ribbons, and now people know who they are. We seek them out. And individuals seeking to ask questions about the program, the single best way we learn about marketing when we did a survey was from those who come out of the program. We can have all their ways on the website, but it's people talking to people, the relationship building that makes that happen.
No, that's great. And I think that's a really good overall comprehensive assessment on it. And I think that's been very helpful for me. And I'm going to kind of ask one off the script here, because especially from a matter of trying to so-called pitch your program director to go for and sponsor you for this kind of a leadership thing, because at the end of the day, I realize there's a lot of other factors in play with this in their decision between time, finances, and stuff. So ultimately what I'm getting at is how would you guys recommend is the best way to kind of pitch the program director to do something like that?
So I'll just go ahead and respond concerning kind of the outcomes and research in general about faculty fellowships and specifically leadership fellowships. There is some evidence, some research, mainly from more long-standing programs that's been published, particularly in medicine, that fellowship programs, and particularly some areas in pediatric medicine, academic medicine, is where some of the literature is that supports, and it seems to be, again, these models of like a year-long program that really embed and have this collaborative, supportive approach that Jody mentioned are really helpful. So there is that. Part of the pitch then would be a lot of the outcomes that we survey our graduates, our fellows throughout the program, and also in longevity. So we currently have, we've graduated the first class in 2012, so we collect data all the way along. And basically up to 75%, on average, 75%, 5 years after they've graduated, have reported that they either have a new role in leadership within their institution or have taken on more leadership roles, whether it's more institutional committees or even within the profession. So it shows that, and then even the short-term data, which is really rare to find in anything in education, frankly, shows even throughout the year of their fellowship that they feel they are more effective in their current position. And that's what we hear a lot too, is that, clearly these are very bright, intelligent people, and they would have achieved those outcomes. The thing is, they've been able to do it much quicker. So I think in our efficiency time and era that we live in, that's a big selling point.
One of the other things I might add, and I'm going to make sure it's clear, this program is not for a new grad. Okay, you have to have a certain level of experience, and we'll be talking a little bit more about what do you need to be accepted. A residency, there are faculty residencies that are accredited through maybe PTRFE, but that is for somebody who's learning the role of faculty. And those deal with things like teaching, service, governance, scholarship. So that's the faculty role. This is distinctive. This is a faculty plus. So I already have that. And now I'm moving into leadership. So I want to just clarify the difference between those two. The second thing, many of the individuals may be a program director assuming that, or assuming a new one. The difference is their confidence level about how they manage programs, faculty, and how they interface with others within the institution is remarkably different. So the program is transformative. So an example, they learn language about accounting and finance at the institutional level. That is not one of the favorite courses that most of our Eli folks take because they didn't go into, PT with money and finance. But they learn very quickly budget, money, and finance is an important piece of how you get to program outcomes when you're leading a program. If you don't have the finances, you don't get to where you want to go. The second thing is many of our grads, if they really enjoy this, have gone on to other programs. So we have some that have gone on to take a PhD in higher education leadership. They've been so enamored with that. We have others who have gone on to programs like Harvard Business, the Academic Council for Education, American Association of Higher Ed, which is an interprofessional, interinstitutional, more expensive, but they've done so well that some of their institutions have actually offered to pay for them to move up in leadership. And those individuals are often targeted within institutions for deans, provosts, and other roles and moving up. So they're picked up and they're seen as having unique skills, characteristics, qualities, and others begin to recognize their talents.
Perfect. So I know, just getting into this topic of course, how to get people to fork up a lot of the money to sponsor. Ladies, were there any other follow-ups that you had besides that you guys wanted to chip in with this issue?
So a couple of things. This is part of a development professional career progression. And so I would have hoped that at some point the individual has probably identified or shared with somebody that someday they might want to be a program director. Now, they have to do that delicately because if the current program director is intending to stay in that position a while, that could be threatening. They might say, at some point in my career, I'm interested in moving into this direction, or they want them to start a new residency or fellowship in the institution. That is a great time to say, I'd like to take a leadership institute. Or if they're a director of clinical education, we know that many directors of clinical education who have a strong administrative component as well as teaching and research and service end up being program directors in the future. So one of the things I would pitch is go into the program director or the dean and say, I'm looking for a more formal way to develop and hone my knowledge and skills in leadership development in higher education. And maybe there's one in your institution. Maybe you first attend that and see if you like it. Someone might say, we have one we offer for faculty at this institution. If I was a faculty member, I'd say, let me try that first. Let me see if it's something that suits me. And from there, I might say, I really like this. I think I'm cut out to be in leadership. I'm interested in it, but I think I'd like something more formal that really gives me a formal curriculum, a formal mentorship process, and a formal recognition process. When I graduate, I'm recognized as a fellow who comes out of a leadership institute as opposed to a continuing ed program. It does make a difference on your business card or your resume when it says Fellow Education Leadership Institute. That's a formal process, and you'll see others from other professions with the same nomenclature on their cards from other disciplines.
Yeah, no, I think that's really helpful. And, I know we've talked a lot about kind of the big pros and a lot of the strengths behind the Eli program, but from your guys' personal insights and kind of maybe what you've heard from some of your fellow graduates, what are some of the limitations that you guys think of the program, and how is Eli looking to change and adapt to best accommodating those?
So some of the limitations, and of course I wouldn't necessarily call them limitations, but areas for challenge. One thing that we've noticed is just the constant evolution of technology in delivering the program. So there are always better ways to communicate in these times, and kind of just staying with the curve on that. In addition to working with, because we do have many institutions working together on the technology. So kind of streamlining those pieces and always working on the delivery of the educational modules. And secondly is just also continuing to stay relevant in the leadership literature. And so ongoing curriculum assessment and, potentially design as we move forward and evolve, not only just in higher education, but in physical therapy, higher education as well.
And a couple of other additional challenges I've heard from graduates is it's a time investment, and they all have full-time jobs. Making a year-long commitment, which is reading, which is investment of time, which is connecting, which is online mentorship with faculty, takes time, and they have to figure out how to put that in their schedule. And they also acknowledge at times they're behind, and sometimes they're ahead because of everything else going on in life. One of the other challenges is the majority of the faculty are not physical therapists, because we're talking about expertise in program assessment. So there are times when faculty choose to move out of the program, or they're retiring from higher ed and they're retiring from the program. And finding the high quality faculty in the other professions who are willing to make a commitment for what, I would be honest, is not a lot of remuneration. They believe in the program and what it brings forward. They are remarkable. They end up also connecting with graduates when they come out of the program. They are lifelong program. And the third part, I would say, is not a limitation, but it's an opportunity for the learner. People have to be vulnerable in this program. There is a great deal of honesty among colleagues and mentors about the individual and their leadership frames, how they think, how they approach, and people in a gracious way are honest with each other. And the people going through this program are vulnerable enough and have to do a lot of self-reflection and assessment to really answer some of these more difficult questions that many of us in our life would like to ignore or choose to put off. And in this program, it's kind of hard to do that, because you're bringing situations forward that you need to know how could I manage this differently, which means I have to do an honest self-appraisal. So that's probably the one that most people don't think they're going to have to do going the program, and discover fairly quickly on the first onsite, oh dear, this is also about assessment and reflection.
No, but I like that though, because honestly, I think even just for me as a clinician, I mean, I feel like that's been one of my biggest keys to actually really developing, is seeing what are my strengths, what are my weaknesses, what went well, what didn't, consult maybe a mentor because sometimes the self-assessment is good, but I've learned that sometimes you don't realize certain things that you do. I mean, myself, and then you need sometimes an objective third party to say, do you realize you say this or do this a lot? And you're like, nope. But now I'm going to think about that every time now. But no, I think that's great though. And, earlier on in the episode, this is kind of an outside Eli question specifically, just kind of a general DPT higher education question, is that regarding kind of the shortage of faculty and the difficulties with that. And, of course, as we all know, with DPT student debt rising and the PT clinician pay ceiling occurring, I'm really curious on your guys' thoughts on how to handle grooming kind of the next generation of PT educators with, current terminal degree requirements for 50% of staff per CAPT, kind of with the current debt and financial position faced by newer clinicians and students to really meet this demand.
So, Brandon, obviously many people are thinking about this and addressing it. APTA does have a financial solution center that I would absolutely encourage both pre-physical therapy students and current physical therapy students, as well as new graduates, to investigate, because that's actually a project that I worked on when I was in the Department of Practice at APTA. And I think right now it's not well enough known. There's lots of financial literacy information there and from vendors. So I would absolutely encourage people to go to the APTA, and it's the APTA Financial Solutions Center. But specifically to faculty and other avenues for that matter, I personally am a good example of most of my whole graduate education, both a master's, a TDPT, and a PhD, were through either my continuing education when I was a clinician or tuition remission when I was a faculty member. So, to think strategically about those things as you move forward in your finances, because clearly the debt is, college tuition is not going down and it's not even staying the same. But again, strategizing your career is really that long-term planning, and that includes finances. Jody, do you have any suggestions?
And I'm going to echo, in the past 20 years, tuitions for colleges, regardless of physical therapy, have risen exponentially, well over 262% actually in the last 20 years. So this is something that's not going away. But if you think about Eli and you realize the graduates learn to think strategically, then that program would be a great way for those graduates to think strategically about how can we redesign physical therapy curricula in a way that is more effective and affordable for graduates, recognizing that debt load and tuitions aren't going down. So these are individuals who are being poised to think in a way that might be more strategic, might begin to examine, are there ways we can still have competency-based outcomes, but do it in a shorter amount of time without being punitive? Are there some possibilities about what we do with entrustable professional activities, competency-based education, and maybe allowing for accelerated for some and others, looking at how we do those modeled differently? And that's going to come from individuals who are actually being challenged to think differently through a program. That's one of the reasons that Eli may be helping us in the future for these graduates.
Yeah, and I think it's interesting too. I mean, someone that I've definitely looked up to with what they've done with education by really changing the model is John Childs with Evidence in Motion through South College, Baylor, and I really like kind of that shortened model in terms of what they're doing for a lot of different reasons, because I know students are definitely really respecting that. And there also has been some discussion on, should we integrate terminal degrees within DPT education? So like a PT, PhD, a PT, DSC, a DSC incorporation. And I know there's been a lot of talk about that in general, but just specifically to address that terminal degree component that's required for faculty.
There are programs that actually are dual PT, PhD. There are PT, OT programs at St. Augustine. There are PT, MBA. So there's a number of those. But the one piece people need to understand is when you do dual programs, you do add time to that program. And there are individual students, having taught for 10 years and certainly Anne for quite a long time, that you can identify when they are in the PT program, they have the talent to be researchers or they have the talent to be an educator. You can see it early on, and people certainly foster and encourage that. But for some, not unlike myself, I couldn't have afforded to do that at the same time. So I took the pathway that Anne did as well. I actually had professional development degree base offset by my employer with, in some cases, a payback for a certain amount of time that I needed to stay, or a position or a program that I was required to develop based on what I learned. So that's the other thing people need to know. In some of these Eli programs, there are contracts that people sign on that say, and I understand this, you can't get the leadership degree, the fellowship, and then move and go to another program. You have to give us another year or something for the time we invested in you in higher ed leadership. So they also need to know there are some contractual arrangements with some, and I can understand. I can send you to Eli, and then you go off and you take on another program, and we don't get the benefit of sending you. All those are part of the equation.
No, I think that's an important point to bring up. And, in general, we like to ask kind of this follow-up question, this question to each of the guests at the end. And, the question is, if you both could theoretically change any aspect of healthcare education, whether that be DPT or just healthcare higher ed in general, which aspect would it be and how would you recommend changing it?
So, Brandon, I get to answer from a perspective of we're actually working on my biggest want and challenge. As I mentioned in my personal experience, I've been a clinician and a clinical instructor a long period of time. And then I was involved in clinical education on the academic side for quite a few years. And clinical education of physical therapists and physical therapist students, we know, is challenging for many, many reasons right now, mostly environmental. So now APTA has developed some charges, to address some of the issues related to clinical education for our department in conjunction with our partners of ACAPT and the Academy of Physical Therapy Education to work on clinical education. So I'll be working on that heavily in addition to Eli for the next few years, for sure.
For a lifetime, actually. I'm going to take a slightly different tack. So higher education was originally put into place many years ago, and it's designed for three fundamental functions. One is it's the place where new knowledge is born. research, knowledge, and they contribute. The second is that it has a long memory. It has institutional memory. And the third is really about mentorship. It's about helping grow people, and they connect people to help their career. And the thing that higher ed is coming into direct conflict with is called the reality of the 21st century and technology in the future. So my wish for the future are really three things, and it's really transforming higher education in a broader mindset. And one is the ability to do risk-taking. Higher education is steeped in history. I call it like turning the Titanic. It does not take risks well. And that translates to physical therapy educators who work in that institution where risk-taking needs to be done. The second is there needs to be greater intentional collaboration to take on issues such as new technology, disruptive innovations, big data analytics, and find ways that those get infused in the curriculum in ways that are functional for graduates who have to practice. And the third is that our programs need to do a better job of assessing outcomes, not in relationship to what they teach, but in relationship to patient care. So many of the outcomes are defined by graduation and licensure. They're defined by employment, how many get jobs. They're not defined by how do our graduates make a difference in today's healthcare and in the future. And they're going into patient care that is actually not going to be patient-centered anymore. It's going to be patient-driven. And that means the patient will own their records. The patient will have the selection of who they want to go to and who they want to pay for. I don't know if our graduates today are prepared for a patient-driven healthcare system. And that means a very different way of looking at what physical therapy education is all about. So for me, it's really about risk and intentionality and looking at changing our lens from teaching and learning to how does this affect and change patient care outcomes for the future and the quadruple aim, our access, our quality, our cost effectiveness, and the last one is wellness. I think the other thing we need to deal with is how do we infuse wellness and health in our graduates so they come out as healthy as they go in instead of coming out less healthy than they go in terms of their own well-being and burnout.
Yeah, no, I think those are some really good points there. And I really respect and agree with both your answers there. And frankly, I'm thankful for the time and insight you guys have provided today regarding the program and just education in general, because I've definitely learned quite a few new things. I'm sure our listeners were as well. But for our audience, perhaps, who if they have a further question or anything like that regarding the program or even on something that we hadn't talked about, where would you guys recommend is the best way so they can either reach out to kind of gather more of that information?
So I'm going to highly recommend the Eli website. You can go to the apta.org, and actually the easiest way is to just type ELI into the search bar, and you will get the overview, information about the curriculum, and also for applicants.
Perfect. Well, thank you again so much, ladies. It's always a pleasure.
Thank you very much, Brandon.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available in our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.